Dr. Therian here, and if you're watching this video, we likely just talked about viral conjunctivitis or pink eye during your eye exam. So understand this video is just to reinforce what we talked about and isn't here to replace the need for eye exams. And so what happens with viral conjunctivitis or pink eye is we had a virus. Typically it's an adenovirus. There's about 500 different versions of them, but an adenovirus got an infection, inflamed the eye, irritated the eye, and caused swelling, watering, crusting, all that kind of fun stuff, just a mad ticked off eye. And so things that I kind of look for on it is, do we have any what's called pseudomembranes going on? So I'll look at the eyelids and make sure that we don't have any like new tissue trying to form, just as the eye is kind of getting mad, trying to kind of wall itself off. I'll look and see, do we have any extra inflammation going on, anything kind of weird or out of the ordinary going on. But for the most part, these are just viruses that need to run their course like the common cold. Again, there's 500 different adenovirus, so there's not a pill, a vitamin, a shot, a vaccine, a whatever that I can give you to get rid of it. And so just like the common cold, when we take some, cold medicine, it doesn't get rid of it, but we can do some things to help with comfort. And so sometimes what I'll do is I'll give patients maybe a little steroid combination drop, a little steroid antibiotic combination drop, or just steroid by itself. And it's going to calm that inflammation down. Now, it won't get rid of it because, again, it's not a bacterial infection, it's a viral. So an antibiotic won't get rid of it. We've got to just calm that inflammation. And so the steroid will calm things down, but sometimes that steroid will make it last a little bit longer. Now, typically these things last about 7 or so days. And so if it's early in the course and you're having a lot of pain and irritation, I may put you on that steroid and it may make it stretch out to about 10 days in length. And so we've got to weigh those kind of pros versus cons to it. You can do a betadine treatment. I don't personally do those very often with patients because it's extremely painful to the patient and very uncomfortable. And it'll take it from lasting about 7 days to about 3 days. And so, typically I don't do it unless you're like in public office or, giving a presentation or a board meeting or something, and we need to get things cleaned up really quick. And so for the most part, it's just self-limited. So I'll tell you, use some artificial tears. That'll decrease the viral load a little bit. Try not to transfer it from one eye to the other eye because it is very contagious. And maybe wash your bedding or your sheets so that we're not just reinfecting ourselves, because again, it's a very common thing for this thing to mutate a little bit and us to kind of reinfect ourselves. From your end, what do you need to watch for? Again, just that it's improving. Give it a couple of days and it should start to get a little bit better. The watering should start to subside, but if you've got that really matted up shut eye, it's a pretty telltale sign that this is a viral conjunctivitis or pink eye. And so as always, this doesn't replace the need for an exam. Those are still important, especially with viruses and that kind of thing. It's just here to help answer questions and reinforce things. But if you have questions, we're always here.